Hi guys, my name is Shelby and today I'm going to be doing my pathology presentation for my human physiology class. Lung cancer is a type of cancer that begins in the lungs. There are two different types of this lung cancer. There are small cells and non-small cell lung cancer. Today I'm going to focus mainly on the non-small cell lung cancer itself. I picked this topic because lung cancer holds a very special place in my heart. My grandfather passed away just 2 short years ago after being diagnosed with non-small cell lung cancer. He was misdiagnosed, which unfortunately is very common in lung cancer patients because of the pneumonia and the bronchitis. They show similar symptoms of lung cancer. He played this game with his doctors off and on for about 3 years of having bronchitis and pneumonia. His doctors just were prescribing him medication after medication, trying new medications to see if they would help with the pneumonia and bronchitis. And 3 years later, after all the medication not helping, they decided it was finally time. There's something definitely wrong. Like, why aren't these medications helping with his illnesses? So they went in and they ran a few tests, and they diagnosed him with stage 4 non-small cell lung cancer. They did indeed go in and do radiation and chemotherapy, and he was doing good with treatments at first, and then was hospitalized until the final time of his life and passed away 4 short months later after being diagnosed. So let's go on and jump on in. What exactly is non-small cell lung cancer? Non-small cell carcinoma is a type of lung cancer that is most commonly known as non-small cell lung cancer. It is abbreviated as NSCLC. Non-small cell carcinoma is when healthy cells form atypically and grow rapidly. There are several types of this non-small cell lung cancer and has difference in each type of non-small cell lung cancer has different types of cancerous cells. Today I'm going to just introduce 3 of those different types. There is squamous cell carcinoma. That is cancer that forms in the thin flat cells lining the inside of the lungs, and this is called epidermoid carcinoma. And then there is large cell carcinoma, which is cancer that may begin in several types of large cells. And then lastly, there's adenocarcinoma. This is cancer that begins in the cells that line the alveoli and make substances such as mucus. So what causes non-small cell lung cancer? As we all know, the main leading cause of lung cancer as a whole is smoking or being exposed to secondhand smoke. According to Manish Khatri at WebMD, doctors aren't exactly sure what causes this disease as a whole. While smoking is one of the main causes, non-small cell lung cancer is the most common type of lung cancers that is found among those who haven't smoked, young adults, and women. Other causes of non-small cell lung cancer is radon, which is a radioactive gas formed in soils and rocks, asbestos, mineral and metal dust, COPD, pulmonary fibrosis, air pollution, radiation treatments to the chest or breast, HIV, AIDS, and it is also very hereditary, which means that it is in your family's medical history. Now that we know the causes, let's talk about some of the symptoms to look for. And according to Christine Cherney at Healthline, in the early stages, non-small cell cancer usually does not have any symptoms. But once you start getting symptoms, some of these symptoms include recurrent cough, shortness of breath, chest pain, coughing up blood, unintentional weight loss, hoarseness in the voice, hard, raspy sounds with breathing, wheezing, feeling weak or tired, lasting lung problems. This includes bronchitis and pneumonia. If the lung cancer does happen to spread to the rest of your body or other parts of your body. Some symptoms that you may experience also include bone pain, headaches, dizziness or balance problems, numbness or weakness in an arm or in a leg, yellowing of the skin and yellowing of the eyes, so jaundice. As we all know, with any form of cancer, there are different stages of the cancers. So I'm going to briefly tell you the stages of non-small cell lung cancer. There is the acute stage, which is the hidden stage, stage 0, stage 1, stage 2, stage 3, and stage 4. If you do have non-small cell lung cancer and you do get treated and the doctors tell you you're out of the woods, you are in remission, the lung cancer is gone. Non-small cell lung cancer is known to be reoccurrent and it can come back. Now, how is non-small cell lung cancer diagnosed? First, your doctors will ask you some questions. After the questioning, they will give you a physical exam. Following that physical exam, they will run a few different tests and want to get a series of images. The imaging includes a CT, a PET scan, MRI, and possibly a bone scan. These images just give the doctors a rough image of how big your tumor is. And then your doctors will also want to go in and possibly get a biopsy. This biopsy is where the doctors go in and they remove a small amount of the tumor under and examine it under a microscope. And this tells the doctors if the tumor is cancerous or not. Treatment options. Who exactly does the treatments? There's a thoracic surgeon, a radiation oncologist, a medical oncologist, and a pulmonologist. All these doctors just have different specialties to what they focus on cancerous patients. And then some treatment options are surgery. The doctors can go in and remove a part of that lung, and after the surgery they go in and destroy cells by freezing them and going in with a heated probe or needle. Those are the two surgery options. Then you can also have radiation. This is used to kill the cancer cells that remain after surgery. Doctors also use this form of treatment to help treat certain cancers that your doctor cannot get rid of during surgery. And then chemotherapy, this can be in a pill form or in a needle into your muscles. This drug travels throughout your body to kill the cancer. Your doctors may want to do this treatment before surgery to shrink that cancer and that tumor. It can be done after surgery, or your doctors may want to do it both, before and after surgery. And then lastly, there is targeted therapy. These drugs and antibodies stop cancer cells from growing and spreading in a very specific way. According to Katri, because of how this treatment works, they usually harm normal cells less than radiation and chemo. So that is my presentation over non-small cell lung cancer. I hope this helped inform you guys on what it is, why I chose this topic, the diagnosis, treatments, symptoms, and all of that. Have a good day, guys.